Good afternoon, everyone. My name is Vernon Vincent, and I'm pleased to be your moderator today for today's Reshape Life Science webinar, ReShapeCare, a reimbursed telehealth program for all weight loss patients. I've been kicking around the field of obesity surgery for nearly my entire 30+ years in medical device. For much of it, I have had what some of you might describe as a fairly narrow focus, working on the lap band in isolation, with a real obsession towards doing everything I could to be part of enhancing outcomes for lap band patients. Well, today I'm very excited to be part of something totally new that can enhance outcomes for all patients, no matter what procedure or program they may have had in the quest for weight loss. Today we will share how ReShapeCare can augment, enhance, and extend just about whatever care plan a practice has in place. Next slide, please. Today is our 5th webinar in the COVID series. All prior webinars are available for viewing at your convenience. Next slide. You'll find a link to those webinars on our Reshape Life Sciences LinkedIn page, or contact any one of us at Reshape and we can get that to you. And next slide, please. A few housekeeping details. All attendees are muted and we can't see you either. So you can be in your pajamas or whatever. Please send your questions via the chat function. If you notice on the far right toolbar bottom, there's a chat option. And send questions as they come up on your mind. Time allowed. At the end, we will address them. And if we do not get to each question today, I commit to get to you by next week with an answer from the panelists that you specifically have asked. And as always, my personal goal is that all of these events, whatever the topic or the audience, that it'd be worth your time and be worth everyone's effort. We have a great panel today that I would like to invite now to join me on the next slide and introduce the experts who we're privileged to have join us. Afternoon, everyone.
Hello.
We have an expert panel starting with Dr. Carl Pesta in Detroit, Michigan. Carl has been doing bariatric surgery since 2003. He's completed over 5,000 procedures, bands, bypass sleeves, and balloons. He is the medical director of McLaren Macomb Bariatric Surgery Institute, and he's very active in the ASMBS as the chair of the Michigan State Chapter and is the secretary treasurer of the ASMBS's foundation. And he's on the Access to Care and Quality and Safety committees, and he typically wins best dressed at most conferences he goes to. Dr. Paul Davidson is the director of behavioral services at the Center for Metabolic and Bariatric Surgery at the Brigham and Women's University Hospital in Boston. He is a Harvard Medical School instructor and is the ASMBS Integrated Health Executive Council member at large and is on the ASMBS Telehealth Committee. Dr. Nina Crowley is Metabolic and Bariatric Surgery Program Coordinator, the Medical University of South Carolina Bariatric Surgery Program. She is the ASMBS Integrated Health Secretary, and she serves on the Academy of Nutrition and Dietetics Weight Management DPG Policy Committee and is on the board of the Obesity Action Coalition. In short, we have a true panel of experts with a common obsession: optimal outcomes for all of our patients. It's a privilege to have you all. Our first presenter today is a good friend now for over 14 years, Ms. Heather Mackey. I've had the privilege of knowing her when she first started her career as a registered dietitian in Dr. David Bollinger's practice in North Carolina. She also has had significant industry experience in the field of bariatric nutrition, and she has presented at several conferences, written book chapters, presentations, and is very active in the Texas Association for Bariatric Surgery, Weight Loss Surgery Foundation of America, Obesity Action Coalition, Your Weight Matters programs, and all things to do with the field of bariatrics. Heather has been instrumental in the creation of ReShapeCare, and is it extremely fitting that she be the person to tell you all about it. Heather, what have you got?
Thank you, Vern. So welcome everyone today to ReShapeCare. Look forward to telling you a little bit more about it, but the basic premise is we really hope to be able to expand your program and improve your patients' outcomes. Next slide, please. So I'm going to review how ReShapeCare can benefit a bariatric program. Nina's going to give us a great overview of the research that currently exists in telehealth and bariatrics and why it's here to stay. We're going to hear from Paul regarding the scope of a healthcare coach in ReShapeCare and how that varies from a mental health professional and how the two can work collaboratively within a bariatric practice. We'll also hear from Dr. Pesta regarding how he plans to use ReShapeCare within his program and how others might choose to use ReShapeCare as well. Next slide. So in short, what is ReShapeCare? It is a reimbursed lifestyle therapeutic telehealth coaching program for all of your patients with clinically proven evidence. And when we say all, we mean literally every single patient that may step foot in your door, from a medical weight loss, from a pre-op, insurance mandated or general, aftercare, immediate to long-term, as well as patient re-engagement that allows to follow a patient. It is covered by insurance for up to 26 visits per calendar year, has a great app with some great logs for like food, activity, food, supplements, also includes remote patient monitoring and integrates with several different apps and devices. It is evidence-based, which I'll cover some of the literature there, and the clinicians are top-notch, which we'll cover. Many of them are dietitians and nurses, but they are most importantly certified clinical health coaches. It includes customized protocols that offers a seamless extension to your practice, and escalations are maintained to ensure patient safety. And as we mentioned, reimbursed by insurance, free to your program while providing a revenue stream. Next slide. So when we talk about the continuum of care, when we think about using ReShapeCare for our medical weight loss, you can use this to build an additional service line within your program if that's something you haven't already incorporated. You could also use this to feed your surgical funnel. Preoperatively, would it speed up the surgical pipeline? Potentially, and enhance pre-op education. How many of you have heard about the new Aetna requirement for pre-op insurance mandated, the 12 behavioral visits? Many programs we've talked to are struggling with how they're going to meet these 12 visits with the current staff that they have on hand without adding FTEs. And we believe ReShapeCare can help meet that criteria. Obviously, patients can use this immediately following surgery. It can also be used for that long term. With being covered 26 visits per year, every single year, it truly meets that long-term aftercare without the financial burden and helps physicians to meet the NSQIP requirement of lifelong follow-up. And then we all have the patients that unfortunately have been lost to follow-up for one reason or another. And we look forward to offering some new programs through ReShapeCare down the road to help re-engage those patients and get them back in your door and back in the program. Next slide. So one of the things that truly makes ReShapeCare unique is the 7 pillars of wellness. So many of our programs cover nutrition, physical activity and fitness, mental and emotional well-being and support very, very well. But the latter 4 are a little more unique and generally not covered quite as often, whether that's due to not enough time in the day or just there's another hot topic that's more pressing. But the piece that I really like is these coaches do a fantastic job of meeting the patient where they're at based on motivational interviewing and stages of change, and then discussing the different pillar related to what they're ready to work on, and then weaving in the others throughout that appointment. And it's really a neat process to watch how many different pillars they can cover in one visit based on patient need, as opposed to coach agenda or program agenda, meaning it's not set in stone that week 1 is protein, week 2 is hydration, week 3 is increasing physical activity, and so on and so forth. Next slide. So remote patient monitoring, this tends to be a hot topic these days. These are relatively new CPT codes that have allowed the healthcare system to utilize the latest advances in technology to gather patient data outside of the brick and mortar setting. It really bridges the gap between that brick and mortar setting and where patients live every day, whether it be the work from home setting or, in their car or wherever it may be. It utilizes sleek technology, whether it's an Apple Watch, a Fitbit, a Bluetooth scale, and many other devices coming on the market every single day. Patients enjoy using these products. They're comfortable using these products. They often sync with their smartphone. And because of this, it increases patient involvement. And this allows clinicians, by collecting additional data, to better understand their patient's health conditions and allow enhancing the treatment. And one of the, I think, most important things is honestly the ability to now bill for activities that clinicians were doing that previously was unbillable hours. Next slide. So we've partnered with InHealth to bring ReShapeCare to the bariatric space. And one of the reasons we chose to partner with InHealth is the impressive amount of clinical data that they have to support their program's efficacy. This graphic here takes 2 of their studies and looks at the amount of, or the number of patients achieving clinically significant weight loss. So meaning more than 5% of the total body weight loss. At this clinically significant level, patients tend to have improvements in their comorbid conditions, including diabetes, hypertension, hypercholesteremia, etc. So in these 2 groups, patients were randomized to either a video conference group, a control group, or an in-person group. The control group was the standard in-office visit, you see the doctor, nothing really different. And then in-person was the exact same materials as the video conference group, but in-person versus video. And what we saw that in each study, the video conference coaching group achieved a higher number of patients achieved that 5% total body weight loss. Next slide. In addition, in these 2 studies, this same video conference group, again, had higher percentage total body weight loss in 12 weeks. And these numbers, 7.2 and 8.2% of total body weight loss, rivaled that of what we see in pharmacotherapy agents in just 12 weeks. This is 2 times the amount of weight loss of our other 2 groups in this study. So very exciting what this program, the philosophy, and the coaches are able to do with patients. Next slide. So one of the first studies they did was, will patients simply show up? Will they do video visits? And what they found was that they had 100% adherence to these video coach visits as opposed to 80% otherwise. And patients were able to implement change. So while all 3 groups increased the number of average daily steps, the video conference group had the highest percentage change increase compared to the other 2. And they think that this is most likely related to the fact that they were receiving that data back from those tracking devices and able to interact with the patient and provide feedback and goals and guidance to further improve those average daily step counts. Next slide. So ReShapeCare is truly a seamless extension. Part of what we do in the clinical onboarding is meet with your clinical team and learn a little bit more about your program. We uncover and really discover the message that you share with your patients so that there's continuity of care and there's not conflicting messaging from what's in your brick and mortar office and then what's being shared from the health coach perspective. Escalations or red flags are agreed upon prior to health coaches seeing your patients so that if something were to come up in conversation, coaches know when to call your office or what is not quite as urgent and maybe can be sent via email. And of course, you have access to the back end of the dashboard as a provider and able to check in on any patient at any time. Next slide. As I mentioned, it's typically free to the patient with 26 visits covered by insurance per year. Generally, there's no copay or deductible for those health coach visits, and it's also free to the program, so no startup cost while providing a revenue stream to the program. Next slide. So the way it works is we complete the service agreement and we do a clinical and billing onboarding. Patients are referred and they download the app, schedule their first appointment. Insurance eligibility is verified and the patient completes their first appointment. After that, the chart notes are securely emailed to your office, and those chart notes can be routed to your EMR and directly into the patient's chart if you want. Next slide. From a financial perspective, the billing can be done a couple different ways. It can be handled internally in your program, whether you have an in-house biller or use a third-party outsourced biller, or our partner InHealth can help us with that process as well if it's something that you want to keep separate from your office. And as far as how all the revenue works out, everything's billed incident to the physician, the reimbursement comes back to the physician or to the program, and then there's a reconciliation. We want to make sure that you are not billed for services that are not reimbursed by insurance. And then you'll receive an invoice for the coach's services as they function under a BAA and are a leased extension of your practice. Next slide. And with that, I'd like to thank you for your time and attention today, and I look forward to hearing what Paul, Nina, and Dr. Pesta have to bring to the table today. Thank you.
So thank you very much, Heather. Before you go, I'm going to summarize, and I've asked you this before, but I just want to be very clear. There's so much information there already. Free to the patient, free to the practice, reimbursed to the practice, increases outcomes.
Yes.
Do I have it?
Yeah. Yes. It truly is a win-win situation. And we've done a really good job working with our partner to try to make it as risk-free as possible to the programs and to the patients. We really want to enhance patient outcomes, provide further support to the patients, and just further increase that treatment continuum out there for our bariatric patients.
And this is truly an extension of any program, an augmentation. Yeah.
Correct.
Sounds good. Thank you very much. We'll talk to you again in a bit.
Thank you.
Dr. Crowley, next slide. And Dr. Crowley, thank you very much for your time today. And you're going to tell us about support for the role of telehealth in bariatric surgery. Please.
Thank you. Great. So next slide. I'm excited to get to dive in a little bit more to some of the research on telehealth and bariatric surgery. And as those of you who know me know, I'm a big fan of motivational interviewing. So getting to hear a little bit more from Heather about what the program is all about. I'm glad that they're using this strategy that I've found works very well with our patients. My program is mostly focused on bariatric surgery, but obviously there is application elsewhere. But I wanted to kind of take a look here at two of the factors of motivational interviewing: importance. And the importance ruler is a tool that we use to say, you know, how important do you think it is to make, say, X behavior change? But in this situation, we're talking about the importance of some of the facets of our programs that we all, we know to be true. We know that an interdisciplinary team of professionals working with our patients in the long term is important. We know that frequent contact is associated with better long-term outcomes, and that psychological support can help patients cope with the aftermath of surgery, like the wording there. But we also know that primary care providers that they're seeing in the long term often lack that nuanced information that we have in bariatric surgery. So on the one hand, we have a lot of factors for long-term care of people who have surgery as being very important. Next slide. And on the other hand, we have a problem, I would say, in follow-up. So it's very important, but I think most of us are very low on the confidence scale that we can actually do that long-term follow-up, whether that be in your practice, knowing that that's the outcomes, or just, what we're seeing here from the research that less than half of patients are returning for all of their scheduled appointments in the first year. 72% missing post-op appointments up to 2 years after surgery. I mean, all of our graphs follow maybe even a steeper decline than the weight loss graphs that we're seeing. Our surgical practices lack the capacity to provide the level of face-to-face follow-up that our patients would need for the long term with our entire interdisciplinary team. And so our patients are not returning for lots of reasons: socioeconomic, distance, work and family, insurance. Many don't understand the importance of long-term follow-up. And so I think we're in that situation where we know it's important, we don't think we can provide it, and so what do? So next slide. So a lot of our patients work on self-help, right? So they're getting this stuff themselves. We know that our patients are using email, text, the internet, and everything in between to learn more about bariatric surgery. And a study a couple years back said 84% of patients prefer Facebook support groups for seeking bariatric information. We also know that over half in this really great study, I encourage you to look at if you haven't, on Facebook, kind of an analysis there, over half of the nutrition-related information by peers is inaccurate. And there's some other interesting findings there too about what people are talking about in advice giving. But that patients are interacting with technology, social media, and all sorts of other sources without the expertise in the nuances of optimizing post-op care. So there's not enough of us to do it. They're not coming back to their programs, but they're out there needing help and looking for it. Next. So I think telehealth was a really great little niche area before COVID, but now everybody knows about it. So that's actually kind of cool. So I expect to see even more research about it as we move through this era. But video conferencing type technology does provide accessible, convenient ways for people to access some of our complex patients who are unable to come to the area. I live in downtown, or we work in downtown Charleston, and people always complain about coming down here because of traffic and parking and all of that. And yet our patients are from, 2, 3, 4 hours away. So video conferencing has been great for that, for our practice right now. In a review, 9 of 10 studies talk about positive clinical outcomes. We also know that e-health strategies can help patients get information and also for providers to get feedback, and that an e-health portal type of a system that's tailored to provide post-op bariatric support can decrease the attrition rates we're seeing in clinical follow-up. So we're able to get them back. And I know in our program, we saw such a high number of follow-ups, something that's usually like 2/3 of patients show up, or we're more like 80 and 90%. So that's been really great. And then internet interventions, we know they can be more cost effective, and that is a treatment option, even for psychological treatment, including acceptance and commitment therapy, which is something we're seeing more of in post-op patients as a way to work with them. Next. So to make it a little easier, we know that telehealth increases access, show rates, follow-up rates, increases patient experience, their satisfaction, their post-op outcomes, quality of life, retention of knowledge about bariatric surgery, increases eating habits, positive eating habits, and patient-centered care, which is a big passion I think we all should share in working with patients who struggle with their weight long-term. We also know it decreases travel time, costs to patients, costs to providers, the burden of getting back to a clinic for long-term follow-up, and disruptions to the daily life for appointments, and that need for people to move from program to program if they are lacking long-term care. We are seeing so many patients for 10 years plus post-op that really need help, and it's just kind of a big hassle getting all the records and getting them established. So to think that they could connect through a technology that keeps them with their people and their program would be nice as well. So with that said, on the next slide, I do kind of want to rest here for a minute to talk about some of these unique applications for telehealth in bariatrics. We know that obesity disproportionately impacts the underserved. We also know that our adolescents prefer technology. They often live far away from the center. There's very few adolescent centers available for them to access. And we also, as I said, patients do not often continue for the long term to see their bariatric expert. So, they may be going to a primary care, they may be going to, someone that does not know very much about their anatomy, and they're certainly not embedded in a program with really great dietitians, psychologists, and some of that support for the majority. So telehealth can reduce also that embarrassment. I think anybody who's worked in the field for a while knows that patients kind of tend to feel like they don't want to come back and feel like a failure if they're not doing well. And so there is a big reduction in that barrier, I think, when they can follow up in a way that feels a little safer for them. Also, the technology ecological momentary assessment, where you can kind of get information that you need from patients as it's happening, reduces a lot of that recall bias and error of memory. So that discrepancy between what people are self-reporting and what we're observing is really going to be a smaller gap, giving us better information and the ability to sort of get an assessment and help them with a treatment or a next step or some goal setting. And then I think the biggest area where I see this is in weight regain. So the longer that your practice is doing surgery, the longer you're in the more patients you're going to have long term that may struggle with weight regain. And I think it's a really tricky area because I don't think we have enough support to do the right thing by those patients, which is very frequent contact and more intense than they've had. So I think this is an area that we're really looking for a way to help people, but we're maybe just not built to provide that level of support. Next. And then I just wanted to share a little piece about in my own center, or in my opinion, our team, our adolescent team and our telehealth team kind of overlap. And so we looked at a telenutrition intervention with our dietitian, Molly, who worked through really connecting adolescents with the direct-to-consumer basically, video conferencing technology. She was laughing today. She saw this and said, yeah, that was really like cool and creative, and now everyone's doing it, but that's really good. So she was working with our patients who are working through our adolescent bariatric program, and the people who used the telenutrition component progressed to surgery about 2 months faster than those who did it through the traditional method. We saw twice as many patients proceed to surgery using these visits. And then the biggest one, which is just crazy how far people were driving, the candidates using the telemedicine to meet with the dietitian saved an average of 182 miles per trip by not driving. So when we're talking about, outcomes and getting back for follow-up and how adolescents tend to, move and go away and enter the workforce, I think it's really impactful to show how telehealth, telenutrition, connecting with our patients can work. Next. So my conclusion is that doing the same thing over and over and expecting different results is insanity, as you guys know, but that ultimately an integrated interprofessional approach to the longitudinal assessment of obesity, especially after surgery, that incorporates mobile technologies will serve to benefit us all. So we need that bariatric specific support from an interdisciplinary team. We know that our patients are active online. They want information. They seek it out electronically. We also know they have barriers to continuing to interact with the program in the long term, and that they appreciate the technology when it is available. So even through our pandemic, we know that our patients need support probably more than ever, and we can reach them virtually and stay safe. So I would say we all know what we need to do. Thank you.
Excellent, Nina. So your data, your in your own hands data, is not only as good as all the other published that we've just seen, but pretty darn impressive. And I want to echo the sentiment of your practice and the distance, how common that is. For instance, we've heard from NYU that you pay $75 for parking and spend a whole day to have a 10-minute visit with your doctor, or stay home and do it on your couch. A lot more convenient for everybody, actually. By the way, the references that were cited there, those would all be available for anyone in the audience that's interested, and any of the data that we presented here, absolutely backing up what we've presented. And I learned something new today. I didn't know what an ecological momentary assessment was. That's cool. Nice
There's
to
some
learn.
good research out there on it, yeah.
Nice to learn something new. All right, great. We'll move on now. Thank you very much. And we'll ask Dr. Paul Davidson to join us. Paul's going to talk to us now about the benefits of ReShapeCare health coaching. Paul.
Thank you so much for having me as part of this. I'm really excited about it. I truly have never heard of a program like this. And I work in a center that has bariatric surgery, endoscopic bariatric treatment, and obesity medicine. And this is one program which actually applies to every single element, the spectrum of care that we offer for obesity treatment. So I think it will apply to all of you, hopefully, in the audience. Next, please. When we think about what these coaches are in terms of a behavioral perspective, it's easy to start by saying, what do they do? So number one, these are all individuals who have an interest in healthcare. As Heather mentioned, a number of them are dietitians, they may be nurses, individuals with undergraduate or graduate degrees in some health-related field. And in order to become a Reshape coach, you have to have gone through a specific training program, which I'm going to allude to in a few moments, in lifestyle coaching, which takes quite a lot of time and energy. They use a holistic and a clinical coaching model. So they're really looking at the whole person. This is a broad-based, comprehensive model of taking a look at helping the individual with weight. They're committed to supporting your patient's bariatric weight loss journey. It's all about what you want out of this. You can find ways to personalize it, make sure it meets your standards. And again, Heather made this very clear. It's one of the very unique programs that allows you to shape it the way you want, and then they will help meet the needs of your patients and your program. They understand the comorbid conditions that are related to excess weight. They're not going to be treating them per se, but they're certainly aware of them and are going to be helping individuals who sign up for this to address those as well. It's also been shown that this type of coaching increases engagement in your program, that those who participate in behavioral health coaching are much more likely to follow up with whatever bariatric program they're affiliated with. And as we all know, individuals who attend sessions and meetings in the bariatric program on a more regular basis tend to have better outcomes in the long run. So they work as an adjunct to your treatment team. Next slide, please. So we think about what they're not. So these are not individuals generally who have degrees in behavioral health. So you're not getting psychologists and social workers, at least at this point. Maybe at some point there will be. And as a result, since they are not licensed mental health professionals, they do not treat serious mental illness or physical illness. So they are there to support and engage, but not to treat. They will not take the place of a member of your treatment team. And as a psychologist in a bariatric program, I took a look at those. Is this going to be an issue for me at some point? And I very quickly realized, no, it's not. It's something that supplements, something that helps, but they will not be doing treatment of mental health issues. They also don't take responsibility for the clinical care of our patients. And so they have an agreement about at what point do they escalate any concerns that they have, so it goes right to members of the treatment team. Let's go to the next slide, please. With regards to healthcare coaching, all these individuals have completed an in-health lifestyle therapeutics coaching academy, which involves a lot of different training. I'm going to talk about that in just a moment, but you need to understand that this model was recently certified by the National Board for Health and Wellness Coaching, which is not necessarily an easy certification to get. And that individuals who have this kind of coaching degree can take a health and wellness coaching exam, which is above and beyond what most health coaches are going to possess. In order to become one of these coaches in the Reshape program, you have to undergo a 16-week training program, which actually can be completed over 6 months. For most individuals, it requires spending roughly 3 to 6 hours a week working on this. There's a variety of different trainings that take place. Some of these are live sessions that are done via Zoom or GoToMeeting. There are a lot of readings people have to follow through, assignments they have to do, and on a regular basis, they get quizzed many times, sometimes many times a week, on knowledge to ensure that they have a good facility with understanding what are the basic health issues that clients are likely to present with. Next slide, please. If we think about the specific skills that these health coaches get, it's pretty broad ranging. And I've got to say, from the behavioral health perspective, it's quite impressive. Many of you are familiar with a number of these terms: active listening, the ability to really hear the message behind the message, start to understand the emotions that individuals are feeling when they are coming for this coaching. And for many people, as we all know, addressing weight has often been a very frustrating, negative experience. And it's the coach's job to try to help meet the individual where they're at and to listen carefully to what they need and put their needs first. They focus on the client, They have sessions to teach them about what are the ethical ways to engage in coaching? What are the limits? What are the boundaries in which you engage and don't cross? Resilience. How do you help individuals who are struggling with a health challenge develop this resilience to make it much easier for them to follow through? And as we all know, the ability to stick with the program is more than half the battle in terms of success in a bariatric program. Impacts of stress is a very significant teaching model. And as we all know, in this era of COVID, we're all under chronic stress. And so stress-related techniques, such as relaxation techniques, are taught to these coaches so they can help your patients learn how to do this. Examining the social issues, because we know as well that these behaviors do not occur in a vacuum, that individuals suffering with obesity have impacts on relationships throughout their life, whether it's family members, partners, siblings, friends, co-workers. They use the stages of change model, which was promulgated by Prochaska and DiClemente quite a few years ago, which really talks about how ready somebody is to make a change. And from what we talk about pre-contemplative, they're not even thinking about it, to contemplative, and eventually they get to these action steps and maintenance. One of the beauties of healthcare coaching is that it may help your patients move from one of these stages to another, so they become more and more ready over the period of time that they have the coaching to take in the information that you're offering and to follow whatever your program is recommending. One of the ways that this is achieved is through goal development. Goals are at the heart of coaching, and a coach will work with the individual to find goals that fit them, that suit their personality, their style, and whatever they need. As Nina mentioned, motivational interviewing is one of the key ways that this is accomplished. And I too use motivational interviewing all the time to help draw out from the individual what they are seeking. This is a mistake a lot of times people might make when they're treating individuals. They tell them what they should be doing rather than draw out from the individual what they are ready to do. And then they have these active practice labs where they practice coaching scenarios over and over and over again, so they start to get a real handle on it. Next slide, please. One of the things that I think is very exciting is that, Nina gave you a number of studies related to this. I found this one particularly interesting. It's brand new. It just came out in the New England Journal of Medicine. A cluster randomized trial involved 18 different clinics that were in the greater New York area. And they engaged this healthcare coaching model with a primarily poor, primarily minority, largely African-American population. And they had individuals in a health coaching model versus those who were getting primary care as usual. And they were trying to take a look at levels of physical activity and weight loss and so on. And they participated in weekly sessions for 6 months. And that's what this does too. There are weekly sessions for 6 months. They followed up with an additional monthly session for the next 18. And lo and behold, 2 years after they started this, those who participated had a 5% total body weight loss, in addition, which was a dramatic improvement over those who did not participate. And one of the things that I think is particularly exciting is that we talk about trying to increase access to those who are underserved, minorities, the poor, and so on. This healthcare coaching offers that opportunity. Next slide, please. In terms of specific responsibilities the coaches are going to take on, they're always going to make sure that this is a safe place in which people can seek lifestyle change. They are also going to respect the fact and expect that clients know themselves best and what they're capable of or not capable of. They're going to help them develop the goals, as I mentioned, and encourage behavior change from a positive perspective. They do maintain confidentiality, and they work with the individual's treatment team as much as is required. They focus on behavioral issues, nutrition, as well as improving physical activity. Next slide, please. The client's responsibility is relatively simple. Clients enrolled in this need to recognize that they maintain responsibility for their success, that they need to come to these sessions prepared to learn and change. And if they're not quite at that, again, the coach is going to help work with them to figure out what's the resistance, what are the blockages that prevent this. They are going to have to set goals for both the short and the long term, and they will develop accountability, which is actually probably my favorite word. They have to be willing to openly discuss things that might be getting in the way of achieving their goals. And lastly, they are expected to engage in self-monitoring. And we know that from a behavioral perspective, self-monitoring tends to be one of the absolute best ways to have long-lasting behavior change, especially when it comes to weight loss. Next slide, please. The behavioral support, as I've already started to mention, takes many forms. One we discussed already was relaxation training, help people find ways to decrease stress levels, which in turn decreases cortisol levels, which in turn helps decrease the tendency to graze or to eat emotionally and so on. People are taught how to deal with hunger and their cravings. I hear this come up all the time with my patients. So the ability to gain some skills in that is certainly very useful. Creating healthy habits, especially in terms of mindfulness and mindful eating. I think every one of us understands that that's critical. One of the skills that's taught is journaling and tracking, and this can be done on app. I'll talk about that in just a moment. Helping improve sleep, because we know sleep has a very significant effect on health and on weight loss. Improving physical fitness as well as nutrition are other significant goals that individuals who participate in this are going to pursue. If we change to the next slide, you'll see the dashboard. So somebody who has this app will take a look at the dashboard on the next slide on their phone, and what they're going to see is there are certain things that are always available to look at. So your weight and tracking that, your steps on a daily basis, the food that you're taking, and it has a wonderful way to track your food. You can use UPC scanning to register what you're getting in. It automatically calculates carbs, fats, and protein for all food types, which makes it a wonderful educational tool. You can track very different kinds of exercise, your hydration, and so on. And you also have a digital library, which is on the next slide. In the digital library, patients or clients have access to this 24/7. They can see videos teaching them about how do I handle stress? How do I do the journaling? What are things related to problem solving and mindfulness? And how do I improve sleep hygiene or ways to relax and dealing with behavioral issues, hunger cues and food cravings and so on. So these are things that they constantly are able to access at any time of the day or night when they're struggling. Next slide, please. As I mentioned, accountability is one of my all-time favorite words because those who are accountable achieve their goals. So coaching winds up helping to supplement an individual's treatment team to increase accountability. It provides a very objective source of information in setting and attaining goals. And these all, again, fall within whatever your specific program is looking for. They provide both emotional and motivational support. And that motivation you cannot get enough of. I always tell people, if you want to find the how, show me a big why. If you really amplify the why, the motivation, people find a way to achieve what they want. Also, this is a program that encourages tracking data, not only for the benefit of the patient, but that data can then go directly to your office. So you know at any given time what your patients are doing. Incredibly powerful. And we know that this kind of a model has been shown to increase weight loss over time. Last slide, please, or next slide, I should say. Another beautiful piece is ease of access. So I think Nina made this very clear with telehealth that all you need is a cell phone or a computer. There are flexible scheduling of coaching appointments. People plug them in when they want to. There are exercises, videos, handouts that they can get. And I think one of the things that's really nice is that one coach works with one patient throughout the entire time. Next slide, please. So I want to thank you so much for your attention, and I look forward to answering any questions you may have later on.
Thank you very much, Paul. It's a lot of information. I'm just going to summarize that you're pretty enthusiastic about this program. You sound like this could really help.
I have never seen anything like it. I've seen coaches in health coaching programs, don't get me wrong, but I've never seen a program that has this level of specificity and that can be made available to such a large group of people at no cost to the individual or the program. That's amazing.
Also, near the beginning, you mentioned a concern that seems to be hardwired into all of us. Is AI going to take away all of our jobs? Are we going to be outsourced by Amazon and Google? And So you've expressed that concern, and your conclusion is this will help you and support you, not replace you. Is that correct?
It is true because I am one person, and I follow literally thousands and thousands and thousands of patients. And as much as I want to be there for every single one at every single moment, I can't. So having something to support it, especially when they are trying to meet the goals I'm helping set, is a win-win.
Very good. Well, thank you very much for that perspective. And we'll move on now for our last presenter, our best dressed, of course. Have Dr. Carl Pesta today is going to give us his presentation on a surgeon's opinion. Why ReShapeCare? Carl.
Hi there, everybody. Thanks so much, Paul, Vern, for having me, and what an honor to speak with this amazing panel. It's been great. Now, I do miss everybody. I'm a social person, and being on lockdown has really impacted me. So maybe I'll be calling Paul for some advice. But it's great to be here with you all and to share my perspective. And I tell you, ReShapeCare couldn't have come at a better time for me. If I talk a little bit about my practice, I'm in private practice. It's kind of a hybrid practice where the hospital owns the intake and the coordinator for the program. I'm one of the surgeons that operates through the program. And when quarantine was starting, our coordinator was furloughed, as well as our liaison. And so we started to struggle with intake. And then our coordinator went on medical leave and then decided to leave for another position. So kind of all of our balls were thrown into the air, and what were we going to do? Well, with this change in personnel, we really needed some additional assistance. And so along came ReShapeCare with an opportunity to start to get some patients involved in a little bit of the intake process to begin their education and get them started in the program, so to speak. So it's been helpful to kind of get the patients who have an insurance mandated preoperative medical weight loss program started. So what I usually do is I have my patients go back for to their primary care for their preoperative medical documentation. And basically it was just a checklist that we provided to the primary care doc so they could basically jump through the hoops that were required. The problem is that they were not getting the education that really is necessary to long-term success with weight loss surgery. So again, ReShapeCare stepped in and we were able to provide them with this education. The primary care docs, who are still my primary source of referrals, are still getting the visits with their patients and providing what they need, but also now the patients were getting the valuable education that is really necessary from a patient standpoint that our program wasn't able to provide in this time of flux. And then we were finding patients who are maybe 6 to 12 months down the line after surgery and could use a little bit more reinforcement. And we are getting them enrolled as well. And then, of course, now we've heard today about the value of telehealth and how important it is for patients to be able to see their physician or their clinicians online. And really, I saw exactly what Nina was talking about was, our office visits went from maybe 70 to 80% compliance to nearly 100%. It's just so much easier for the patients to click on their phone or computer, and then we'd have a nice chat about how they're doing in their process. So we absolutely know that telehealth is really benefiting our patients from a number of different standpoints. Next slide, please. So what really made it appealing to me, I think, first of all, I want to start out with the seamless extension of my practice. We had a number of phone calls and even more emails to really talk about how is the practice of surgical consultants? How do you like your patients to be guided through post-surgical care? Everything from nutritional advancing to their supplements. And basically, so through our conversations, we were able to really just kind of map out how I like to guide my patients. And so now ReShapeCare becomes a direct extension of that. And I think that was really one of the most important points to why it is so appealing to me, because it is literally my guidelines and my treatment protocols just given to the patients by our health coaches. Now, of course, the reimbursement by the patient's insurance is very helpful as well, and certainly makes it more appealing to the patients to not have to pay out of pocket necessarily for that. And I think another very important point is for all of our patients, whether they are doing medical weight loss, whether they're lap band patients, whether they're sleeve patients, gastric balloon patients, bypass, whatever it is that they are using, this is definitely an adjunct to their overall care. I think we had a question as far as BMIs covered, and for most it's BMI over 30, for some over 27, but you can ask that question more directly, but I just want to touch on that. So there's no upper limit for BMI coverage. It's somewhat insurance dependent, but really it was fitting for all of the patients in these different structures, regardless what type of care. We've hit heavily on the evidence-based, patient-centric approach about how beneficial it is, and it's free to my practice, so no expense to my practice, and we'll talk in a little bit about how it's even generating revenue for my practice as well. Next slide, please. So as I kind of touched on this, which patients would this benefit in my program? I'll talk to you at the end about one of the medical weight loss patients that we're currently treating, but also, as I mentioned, with lack of support from our hospital program currently, it's a great opportunity to enroll my patients for just general preoperative instructions, things that we want to talk about, from the pre-surgical diet to prehabilitation for surgery. So all these enhanced recovery type protocols that we use are now part of our preoperative program. If it's insurance mandated, of course, this fits in perfectly, just like I mentioned earlier. Aftercare, whether it's immediately post-operatively, they can help coach my patient through their nutritional guidelines. It's great for aftercare as far as long-term goes. And I think one of the patients I'm really focusing on now are re-engagement. It's hard to believe that I've been doing bariatric surgery since 2003, but I saw a patient in the office just this week who had her surgery in 2003, and I hadn't seen her in probably 4 or 5 years, and she came back with that COVID-19 weight gain and said, Dr. Pesta, you know, I haven't seen you in a long time, but I'm really struggling here. And so I've got a great opportunity for you to kind of re-engage and get back on track. And so we started talking about ReShapeCare, and so she's in the process of enrolling that as well. So loss to follow-up patients. You know, I see patients from a number of different programs. I really feel as a bariatric surgeon, it's important to follow up with my patients long-term, lifelong. I tell them they're stuck with me forever. So when I hear from these patients from so long ago, whether they need a hernia repair or a gallbladder procedure, I'm still their surgeon, and so they come to me for their other surgical needs. And always weight loss is tied into this, and we're able to talk about how we can help adjunct the care in my office with the education from ReShapeCare. Next slide, please. So what are my future plans? So not only am I using it for these patients that I just talked to you about, but as an accredited center with the MBSA QUIP, we know quality improvement is always a goal in any surgical program. We have lifetime follow-up. There's also patient satisfaction surveys and patient engagement monitoring that is part of the ReShapeCare program. And so by using this, you can see it's really easy to track patients who are on the program versus who aren't, patients who weren't on the program and now are, and you can see how that will turn into a nice research project or quality improvement project. So I think that will also be very beneficial to using ReShapeCare in my practice. Next slide. So a lot of people like myself are in private practice and are looking for additional revenue streams. Each insurance is obviously different. The people at ReShapeCare within health will look at the patient's insurance to see if they are candidates for reimbursement from this. And then based on their activity throughout the year, the coaching services will then reimburse my practice and then be charged from ReShapeCare or in health for the services that were covered by the insurance, with the top part of that going to my practice. So, you know, everything's variable as to how much the visits are reimbursed. But, you know, if you start to enroll more and more of your patients into this program, you can see revenue streams varying anywhere from, you know, 20,000 to 40 to 60,000 based on how many visits they're doing, how much reimbursement you're getting from their insurance. And then if you start tacking on that remote patient monitoring that we've been talking about, from the Bluetooth scales to the Fitbits to nutrition trackers, that is also going to add revenue to your practice or to the hospital's bottom line if you're a hospital employed practice. And anything that's bringing financials to your bottom line can be reinvigorated into your practice for marketing, for patient engagement, for patient celebrations or parties. And the last part here, the nutrition supplements, because we do partner with some nutrition supplement companies, which also offer reimbursement when we direct patients there. Our health coaches with ReShape have been educated as to where to send our patients for their supplements. So the patient will again be referred to our supplement partners, who will then in turn return some funds to our practice as well. So really the financial aspects of this are very intriguing and very welcome into the practice as well. Next slide. What you'll see here are some of the materials that I've received for the patients, and it basically makes it a turnkey solution. Very high quality patient engagement tools, for a tabletop banner that I would set in the office, to a digital brochure that we can send to them that gives the details as to how to enroll, a print brochure that we can hand to them as they walk out, and a welcome letter that's provided to them to help them enroll in the program. So all of it is very turnkey and very minimal hassle from the practice, so to speak. And again, working with the ReShape team to make it more coordinated so that it's basically a direct extension of your practice makes it phenomenal. Next slide, please. So I just wanted to kind of wrap up with a case study of one of our medical weight loss patients. This is a 51-year-old female who came to us with a BMI of 33, and she started on her visits. And 7 weeks into her program, which is, 7 visits into her program, which is about 6 weeks, has already transformed a lot of her behavioral habits. And you can see the change in her BMI from 33 to 31 in those 7 visits, lost 18 pounds. And Paul and Nina talked about, and Heather talked about how the coach set smart goals with the patients that are attainable, that are measurable, that are basically in a timetable. See how the SMART goals fit into that. And it incorporated physical activity because we know this tracking is very important. The accountability, as Paul mentioned, is very important. The health coach helped this patient do a shopping list and use Shipt to help the patient shop, and this arrived at her doorstep. I mean, just think of the convenience of that for your patients and how rewarding that can be. And now this patient actually looks forward to weekly coaching appointment. Next slide, please. What I want to share with you here is basically, we're still paper charts, believe it or not. So these patient notes can be integrated into your electronic medical record or in a handy folder, just like we have here. But if you look at this, I know you can't read it necessarily, but it's a very detailed note that you will receive for each visit. And I was really impressed with how it outlined what the patient was going through, what were the plans for the next visit, how is the patient being accountable. And so I think the detail is just excellent as far as what you'll be receiving from the patient, and certainly justifies the visits that you will be billing for. Next slide, please. I basically will wrap it up with that, and look forward to any questions that you may have. Again, thank you for the opportunity to talk. I look forward to seeing you all when this virtual life settles a bit. Thanks so much.
Dr. Pesta, thank you very much. Very credible. So to confirm, you are comfortable with the extension to your practice, the augmentation of your practice.
Absolutely. Yeah, it's nice to have that conversation with the ReShape team to really outline my protocols. And especially, we didn't talk a little too much about the escalation protocols, where these coaches, if they have any concern and the patient mentions something, we kind of have a plan outlined of how to get in touch with me. I give all my patients my cell phone number, and the ReShape team just kind of says, okay, this is an area I'm maybe a little concerned with. Let's turn you over to Dr. Pesta to have him address this, and then we connect with the patient.
Excellent.
Really nice.
Excellent. And so a question we had was really about how is this customized to your practice? And really you explained that beautifully in talking with you and understanding what your protocols are and have your patients be followed by our coaches as if they were in your office.
Exactly. So the protocols that we've laid out are followed by the Reshape team and explained to my patients. And again, if they have any concern, they get in touch with me.
Excellent. Great. Next slide, just have the whole faculty back. We have a couple of things to cover. We would like to remind everyone that there's a walk from obesity coming very soon. You have a couple of opportunities. You can sign up with the Walk with Reshape Life Sciences, or you could walk with Pesta's Pride. You have a couple of great choices. And one way or the other, everyone should participate. This is a very worthy cause and maybe one of the only avenues for raising money to deal with awareness and doing something specific for obesity. A couple of quick questions. Nina, how do you integrate the Reshape program and registered dietitians together? How's that going to work with your dietitians and the coaches?
Well, I think the biggest thing that I'm hearing from my dietitians right now, we have two. One's one like 1.5. Is that they're hearing from so many patients who are kind of falling off track and needing extra support during COVID. And so I think what I've seen like in the listservs and all around in the dietitian community is everybody seems to, always be scrambling to put together some sort of back on track program. And so my fear when I see that is that it's just sort of let's try to figure something out. It's not evidence-based. It's not based in behavioral, theory. It's more based on, well, don't eat this and stop eating carbs and don't, and so I think this is a way to say we have evidence, it's consistent, you've built in support, you've built in accountability. So I see a big area in the weight regain part, and then really like with switching programs. So, we have so many people come to us because we might offer a revisional procedure down the line, but what they need is this. They don't need the surgery necessarily. And so can they get this through their original program and keep their team and not have to do so much schlepping around of stuff and have a better outcome? I think that's another area that we're really gonna.
And those people, if they do end up going for a revision, they're probably been way more prepared and educated when they get there.
Yeah, for sure.
Excellent. Paul, in bariatric surgery, we talk about indications and contraindications and kind of built into our hardwired brains. Do you think of any individual in your care or anyone's care that should not participate in coaching like this?
It's an interesting question. So when we think about contraindications to bariatric surgery, at least from the behavioral perspective, we're generally focused on individuals with active substance abuse, active serious mental health issues and recent psychiatric hospitalizations, issues with engaging with the team. Sometimes we see personality disorders, any case of an active eating disorder, or these are individuals for whom we might feel it's not the right time to pursue surgery. I think it would be very important for coaches working in this program to understand that these are the expectations that your program has set, because one of the last things we want to do is create a sense of false hope among potential patients by a coach who doesn't realize that these are going to be contraindications. So I think those people who we see as not really ready for the surgery, we may not want to have them do the health coaching, at least for bariatric preparation yet. It might be a shift in which you start to use the coaching to simply focus on health in general, improving to the point at which they may eventually qualify for the procedure. Clearly, though, any serious, mental health issue, substance use issue, eating disorder issue, I think it's beyond the ken of these coaches, and they should really be referred to mental health professionals and/or back to the bariatric and metabolic programs, and maybe have them come back to coaching at a time when they're in a more stable place.
Very good, very good. Last question. We've run over a little bit. People are hanging in there, so this one goes to Heather. How would a program like this help meet a pre-op requirement?
Yeah, great question. So we've actually set this up a few different ways, and it really depends on a program and what the program actually wants. And that's the great thing about it, is it's not set in stone. We have some programs that are referring, for example, like the Aetna, all 12 visits to ReShapeCare. We have other programs that maybe they have a 6-month mandated insurance requirement, and maybe the first and the 6th are done in the office, and then the other in-between visits are done through the ReShapeCare health coaches. The great thing about it is there's a lot of ability to modify this based on what each practice and each program and each physician wants. And we have that ability to provide that continuity of care, but still meet that insurance guideline.
Very interesting. Well, thank you, everyone. We've run over a little bit. We started a tiny bit late. I appreciate the audience has held in there solid for the entire hour plus. The credibility and the value of your opinions and the data you've presented today, very much appreciated, all of you. And I hope you have a nice evening tonight. Cheers on us, virtual hug to everyone. And I'll just ask a question and leave it hanging there. How many of you are wearing pants and shoes? That's the COVID Zoom question of the day, right? So we'll just leave that out there for the last people who stayed on the line. Oh, there's Pat's even. I'm not gonna share. Thanks, everybody. Have a good evening. Thank you very much.